Good morning, everyone. Today I want to talk to you about a situation where if you hire like an associate or if you're a dentist yourself as well, and then you will find that you a lot of dentists probably justify doing or performing certain treatments because they prefer doing that treatment, and then they find a lot of justification to justify why this treatment or this way of doing dentistry is much better than any other way. So I'll give you examples, but first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own and run my own dental practice in Harvey Bay, which is called Lakeside Dental Spa. You can check the details below. And I took this practice from 1 chair to 10 chairs over the course of 14 years, and I hired many associates during this process. And I just have to say that for credibility, so if you're listening to me, you know where this is coming from. So I'll give you 2 examples that I dealt with 2 associates in the past, and sometimes there are things that could be missed in the interview process, and you only discover when they start working for you for the first month or 2 or 3. This video also might benefit an associate. You could be on that position as well. Example 1, there's one dentist, and probably in the first few months, they haven't done a single indirect preparation. So they didn't do any onlays or veneers or crowns, which is very unusual for a general dentist. So when I start looking into the notes and into the patient files, I realized that the dentist doesn't give the option for crowns or onlays or veneers, and when they did, they also they give the option in a very negative way. So for example, I will see something in the notes like a patient has a big class 4 filling, like broken front tooth. And ideally, in a situation like that, you want to give the patient the option of having a resin or a plastic filling or a crown and the difference between them. And if you have very good experience, you will understand that probably a ceramic option might last much longer than a resin option or a plastic option. But in that situation, the notes would be something, it gives the patient the options, but I explain to the patient, since they work in a bar environment, they are subjected. Sorry, I don't mean to laugh or smile, but it's has a bit of humor in it. Given that the patient works in a bar environment as a bartender, he could be subjected to a lot of fights, and if he gets into a lot of fights, he might break his front tooth. So I told the patient it's better to have a plastic or resin filling, so at least if it's broken, you can always refix it a lot cheaper than having a porcelain crowns and end up in a fight. So the treatment is based as the patient, and there is a lot of examples, not just that, whatever the profession, patient could be a doctor, so being a doctor, he could be rich, he could be walking down the street, someone will try to rob them or rob their wallet, so they might beat them up and they might lose their front teeth. Anyway, there's some stupid stuff like that. And for me, that was a bit humorous. And the other dentists as well had similar situation. So they were there for a few months. Again, not a single indirect work, not even mentioned this time. So this dentist did not give the patient the option of having any indirect work. When I confronted both dentists, they always come, instead of admitting that or trying to even talk about that they have limitations in their skills or they can perform crown preps well, they always have to come from a very high moral angle and saying, look, I don't believe in crown work because I'm very conservative. I don't like to cut enamel. I'd rather preserve enamel. So I'm very conservative, and they justify that by saying that they're doing the right thing to the patient. Now, I don't think it's easy to change that attitude, because if you're a general dentist, graduated from dentistry, and you completely think that doing a crown preparation on a tooth is something's not right and it's not conservative, then it's be very hard to convince you. So sometimes you couldn't get to anywhere with them. But my point here is they justifying their treatment preference and trying to come from a high moral angle, that's saying that's the best for the patient. But when I click down more, okay, let's go down this route a little bit. Class 4 filling, yes, you're conservative, you're just beveling the enamel. I agree with you, you're putting this resin filling. Now, if this filling breaks or then you'll have to do a wider bevel, and then you keep going and putting bigger bevels. You're still removing a lot of enamel during the process. Assume a large 5-surface composite on a posterior tooth after root canal treatment. Yes, you're protecting the cusp, but how long this filling can last. What if it chips? Patient is not aware it's chipped and start getting some leakage under the chipped area. They start getting recurrent decay. The coronal seal is lost and the root canal treatment is failing. I start to go down a little bit just to counter the logic, but they still didn't get it. But when I click down more, look, I'm sure there is more into this than just being conservative. It doesn't make sense to me. Explain to me more your journey with doing crown preps. How many crowns have you done after graduation, for example? And I'm talking about an experienced dentist there. And they eventually came to the conclusion that, admitted that, well, I find it very, very uncomfortable when I send the impression to the lab, then I get a crown that's not fitting. This anxiety where I don't have the control over the part gives me a lot of anxiety. And I've done some crowns and sometimes they don't fit, and I have told the patient the crown is not fitting and color is off. I'd rather have control over the fit and the color of the restoration. That's why I prefer to do composite. And they did beautiful composite work, by the way. So when you understand that more, then you understand this is going to be hard to change for sure. I mean, if you done enough indirect work, if you work with a good lab, your prep are beautiful, your lab is good, the chance of lack of fitting is really low, and getting the shade wrong doesn't happen a lot if you're very experienced. But I think they got blocked early on in their career at that, and they like to have a lot of control. The point of this video is, what I've noticed is a lot of dentists will justify their lack of skill, because there is a lack of skill there, by coming from a moral angle. And if this dentist is an associate in your practice and you find this lack of skill is important for you to keep the skill in your practice, then you might struggle with the associate and sometimes you might have to part way. But if you have an associate that doesn't want to do any indirect work, but they inform the patient of indirect work and they refer internally to another clinician, no problem with that. Or if the dentists only perform 5 surface composites and they seem to be surviving well and you feel like these should stay in your practice, there is nothing wrong with that as long as you understand the limitation. So if you find this information helpful, please make sure you like and share it with your friends and colleagues. If you want to listen more about my stories and my videos, make sure you subscribe and also you'll be notified when more videos are released. Thank you so much for listening. It means a lot to me.